Welcome. My name is Zara Stepp with Step Above Massage and Wellness. I am a massage therapist in Loveland, Colorado. Today, I have a foam rolling video for you that's going to really help if you're dealing with hip pain, low back, and even up into your shoulders. We're just going to do two areas, but we have to do it on both sides. So we're going to spend, I'm just going to kind of estimate, but probably about 3 minutes on each side. All you're going to need is a foam roller. As we go, we're going to be using an intensity scale from 1 to 10. We're doing a type of self-massage that is similar to myofascial release or in some areas trigger point therapy. So we want to make sure that we're working at the right intensity. 1 is not very much sensation. 5 is like the perfect amount of pressure. And 10 is so much pressure that you can't breathe through it. You're clenching your teeth, squinching your face muscles. You can't relax your body as you're going. We want to kind of be working anywhere between like a 3 to an 8. It's just going to depend on the area. Some areas won't be as sensitive. Some areas where there is more tension, it might feel more intense. If we get into this and you notice that it feels kind of numb or not very much sensation, what I want you to do is focus on sending your breath and your awareness to the area and slowing down. And oftentimes what you'll find is by actually dropping in and giving yourself time and awareness that the sensations will start to come out. It's kind of like having to build trust with your body. So the two areas that we're going to do on both sides is we're going to do the hips, like kind of glutes and the sides of the hips. And then we're going to get up into the lats and the back of the armpit area. So let's go ahead and start with the glutes. The way I like to do this is going into a side plank kind of position, popping up and rolling the foam roller down and posting with the elbow stacked under the shoulder and this back leg as a kickstand, kind of keeping the other leg extended. You can do a little bit of rolling back and forth just to get an idea of where the sensitivity is. We're kind of rolling between, you'll notice the lower you go, you might start to hit an area that's pretty sensitive and hard, and that's a bone, that's the side of your femur or your thigh bone. And then up at the top, you might hit kind of a ridge and then fall into your oblique and side stomach area. We want to be rolling between those two spots. So into the muscle and side of these hips, we've got the glutes, part of the glute max, but mostly medius and minimus on this side. And then the more you roll forwards, which you can do by taking this back kickstand forwards, you're going to start hitting into your TFL, which is the tensor fascia lata, fancy Latin name. It's one of the muscles that acts on your IT band. So if you notice that you have a lot of IT band tightness or even knee pain, sometimes you have to get up into this hip area to release the muscle. So as you kind of explore, what you're going to take note of is any areas of tenderness. You might notice more tenderness when you're shifted backwards like this, more into the glutes. Or you might notice more tenderness when you shift forwards into the TFL and glute medius and minimus. I notice more when I shift forward, so this is where I'm going to focus. When you do body work for pain relief, you are kind of following the tenderness. So here, the key is to just slow down, breathe. I would say the intensity here is probably about like a 5, sometimes 6-ish, and I'm going to stay in that area, trying to bring the pressure so that it's pressing directly onto that area. Sometimes you'll have to put pressure directly onto it or almost at an angle. And body work is very intuitive. You kind of learn a methodology to it, and then you go from there with what feels good in your body. So what you'll notice is as you hold an area, the intensity will start to decrease. Sometimes it takes a couple treatment cycles to get the intensity to decrease, but I would say that in general, you'll notice that the longer that you hold it, it starts to diminish. So then you're going to keep following it. Maybe that means you have to shift up. It feels a little bit tender there. I feel like I need to maybe shift forwards. Not too bad, probably like up here feels maybe like a 2 or a 3. But then as I start to shift, my body is going forwards, but the pressure is coming down more towards where that thigh bone is. That's where I really start to feel now the intensity is going up to maybe a 6, 7, in some places like an 8. 8 is the threshold where we want to be working. So what I'm going to do is just hold and breathe. Keep trying to relax and almost melt the muscles into the pressure, right? If you're tensing and bracing against it, then you're kind of counteracting this massage. Might take a little bit longer for areas to release. I recommend spending anywhere from 2 to 5 minutes on an area, and when we move and we follow it, we're moving in millimeters. So where I was kind of started to drop down, and then I started to shift slightly back, and then boom, it was back up to like a level 8. So then I'm going to just spend a couple more breaths here. See if you're on a spot of tenderness, go ahead and just breathe into it. About 2 or 3 more breaths. Good. And then we're going to release. You can shake out your leg. You could walk around and just see how this side feels compared to the other side. Then we're going to switch and let's do that other glute. Left side. Coming into the side plank again. Going to press into this top leg to lift my hips, slide it back, and you might have to kind of play with the orientation. And to start off, I'm just using this back little kickstand to push me forwards and backwards to explore this area. Again, on this side, it doesn't feel too tender when I shift backwards, but your body might feel different. You might notice a lot of tension back there. So you're going to spend more time kind of angling and holding pressure here. But on this side, it was more forward. So I'm going to try it on this side, taking the top leg up. And then as I start to slowly rotate, sure enough, start to notice some tension on this kind of front side. What's interesting on this side that I'm kind of noticing that wasn't on this one is it feels tight but numb, and the intensity isn't super high. Like right now it feels like maybe a 3, maybe a 2, like not that bad. And so because I know it's tight, I'm going to send some breath down to that area and my awareness. And now it's almost as if the muscle has relaxed enough to even start to feel. And now the intensity is there. So you're going to follow that intensity, looking for a level maybe 5 to 8. If nothing in this area is super intense, you're just going to kind of find where it is the most, and that's where you're going to send your breath. You can even angle yourself almost so that you're kind of orienting your hips down towards the ground to get more of a hip flexor orientation. I don't know too many people that it is not tender or sore in this area, just because how our society sits so much and how we externally rotate through our feet. It tends to put a lot of pressure up in this outer hip area. Breathe. Doing foam rolling isn't just about, massaging out the muscles. It's also bringing your awareness to that area. You're going to get even more change is what I've noticed. So like you can definitely foam roll while you're scrolling Instagram or watching TV if that's what actually gets you to do it. But I think that you'll find the most benefit from when you actually bring your awareness and your breath to the area and just set aside, 10, 15, 20 minutes once, a couple times a week to taking care of your body, right? We demand so much from it, whether it's in our physical hobbies or if we're just sitting all day, we don't always take care of it. Good, we'll spend just a little bit more time on this side, balancing them out. Sometimes you'll notice that one side doesn't feel like it needs as much time as the other. So you don't feel like you always have to spend exactly the same amount of time on each side. If you go on and explore and it's like, I don't really notice too much tenderness, then maybe this side just didn't need it. It's always good to check in and see if it does. Let's take about 3 more breaths. It's a combination of breathing, holding, and then small little micro adjustments to find the next layer. Good. All right, releasing that side, maybe shaking out your legs, seeing how it all feels. And then we're going to go into the lats. So I'm going to go back to my right side. You can pick whichever one that you want. We're taking the foam roller right up into the back of this armpit area. You can take it onto your rib cage, but a lot of people that tends to be super tender. So we're going to take it more up into this meaty area on the back of the shoulder. And I'm laying on my side, little kickstand here just to help me kind of roll up and down. And you can also angle yourself backwards and forwards. And there are a ton of muscles that connect into the shoulder blade. So I'll put a little image up on the screen of the anatomy, but we're hitting lats here. We are also hitting some of, if you rock backwards, you're hitting teres minor, teres major, infraspinatus, all muscles that are close to or a part of your rotator cuff. So by doing some self-massage on this area, you can help relieve back pain because the latissimus, it acts on the shoulder and the back. And then you can also relieve a lot of shoulder and neck pain by working this area, even pain that can radiate down into your upper arm, forearm, and wrist. So at first, when I kind of got into this area, it felt pretty tender. So I was just kind of trying to not make it too intense. Then the intensity diminished. So now I'm going to start to do tiny little adjustments, exploring this forwards angle. And you can keep rolling it up sometimes farther than you might think. You can just kind of explore. You might need to kind of caterpillar scooch your hips down. And then I almost like arch up so that I have more of my weight pressing down into the foam roller if you need more pressure. You can even, lift and bridge your hips up if you need even more to get the intensity that you want, but you probably don't need to do that right away, just as an option. And what I'm noticing is I feel a lot of tension up where my shoulder and my arm meet. And so it's kind of like I'm hitting part of the rotator cuff and I'm just angling backwards, part of the shoulder cap, the back rear deltoid, and then even into the triceps. So there's just so many muscle attachments, and oftentimes where the attachments are is where you're going to find a lot of tenderness. Breathing into it. Sometimes areas also will release or the intensity diminishes very quickly, so you can just keep just slowly moving. As I roll forward, I'm noticing an area of tension. Breathing into it. Good. Now I'm kind of trying to explore a little bit farther down towards the ribs where there's still some good meat and muscle. It's not like you're just grinding over the bones. The lower that you get, the less muscle there tends to be. So it's a little bit more like not comfortable. But you can find some really good spots on your upper ribs as you can either roll forwards and you'll hit that edge of latissimus, and you might even get a little bit of serratus anterior, or you can rotate backwards. And if you don't know all these muscles, that's okay. You're going to feel them most likely. I'm going to put images up on the screen too so that you can see which ones I'm talking about. Good. Let's just take another 3 breaths on this side and then we're going to switch. If you're feeling a lot of tension in this area and you feel like you want to spend a little bit more time, feel free to pause the video and spend a little bit extra. As a beginner, I really wouldn't spend more than 4 or 5 minutes on each side because you can do too much too quickly. Let's go ahead and switch sides. And you can overwork an area either just by doing too long of a session, or you can also overwork an area by going too deep too quickly, and yanking that intensity up is sometimes too much for our nervous system. So oriented on this side, little side position, you can do kind of like separate legs. So you have a kickstand. You can orient your lower body however feels comfortable for you. And again, I'm taking this foam roller right up into the back of that shoulder and armpit area. Your neck might get a little bit tired. You could prop your hand up like this and still do some good work on this back area. I think sometimes people are surprised by how much tension is in this area. We put a lot of focus in massage on like the back and the neck, which are important, but I feel like sometimes when I get a massage, this area gets completely missed. And like I said, there's so many muscles and attachments back here that it's just, and the way that we use our arms, whether you're weightlifting or, on your phone, on the computer, driving, playing sports, we just put a lot of stress on our upper limbs. And so many people have rotator cuff issues. And a lot of it is just an imbalance in strength, weakness in muscles, excessive tightness. So by breaking up the lats and this kind of back of the shoulder area, people store a lot of tension back here. Good. Remembering you are just trying to follow the tension. You don't need to know the muscles exactly in order to foam roll like this and for pain relief. Really, you just need to get into the position and then follow for the tenderness. And when tenderness, it's also, there's a difference between a good and bad pain, right? Doing this massage is a good pain. It's hurts so good. It's therapeutic discomfort. It's maybe dull and kind of achy. The pain that you want to avoid is a sharp sensation, a burning sensation, anything. You'll feel it where it just feels wrong, or when you go over a bone. You can work over bone in some areas, but usually it's just a little bit more uncomfortable. So obviously I'm not there with you and I can't feel what's going on in your body. So you're just going to have to follow that tenderness. If anything feels weird, what I would just say is kind of back away from it, find a different spot where okay, yeah, that feels like it needs this work, and it's not creating any kind of sharp, lingering pain. Again, you can move down onto those upper ribs where there's the lats and serratus, especially if you do a lot of chest work like benching, or if you are a Muay Thai or MMA fighter. Serratus tends to it can get tight and get some trigger points in it. Now, what you might notice is there's areas that you'll go onto and you feel sensation there, but you also feel sensation in another area, and that is pain referral. Oftentimes that happens when there's a trigger point in that area, but it can create referred pain in known patterns to different areas. So what's interesting, as I'm pressing on this spot in my lat and kind of serratus, I'm feeling it in my wrist and towards my thumb. All right, maybe 2 more breaths on this side. Good. Amazing. Shake out your arms, see how you're feeling. Hopefully you're feeling better, more expansive. What I notice a lot after I do sessions like this is blood flow. Sometimes I feel warmth. I feel like a better range of motion and just kind of like a sense of well-being. So do these videos, try to pick one a week, or if an area is bothering you, you might want to try treating it every other day or every couple of days. What you will notice is you might feel a lot of tenderness one day and then you go back to it another and it actually doesn't feel as intense. Often as the pain diminishes, that's a sign that the tension in that area is releasing. So thanks so much for joining. Make sure that you are subscribed to the channel, that you like and share with others, anybody that might be needing this kind of work, and keep the notifications on so that you get notified when I post future videos. Thanks for joining. I'll see you guys next time.